The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com.
Good evening everyone. Welcome to a new episode of BMC Global Live Hilal Health World, Nothing But Lifestyle. I am Anupama Menon. In this talk show Health World, we have expert doctors from various fields providing valuable information to assist you all on your journey towards good health. A lot of kids in today's time grapple with the problem of asthma. As we all know, asthma leads to breathing difficulties, and this in turn can negatively impact the quality of life of a child. I'm sure all of you would like to know more about this problem. To discuss the problem of childhood asthma in detail, today we have with us Dr. Ruby Muneer, specialist pediatrician from Al Hilal Hospital, Muharraq. Dr. Ruby has an experience of over 5 years in the field of pediatrics. So let's go over to her and know more about childhood asthma. Good evening, doctor. How are you doing today?
Yes, fine.
Welcome to the show.
Thank you.
So doctor, before we begin, we have all heard about asthma and we normally associate it with breathlessness. So how would you define asthma in medical terms?
Asthma is actually it is airway hyperresponsiveness, or we call it as hyperactive airway disease. It is inflammation of the airways and the lungs when the patient is exposed to certain allergens, yani indoor allergens, outdoor allergens. It can be viral infections, it can be pollens, spores. So when the patient is exposed to these allergens, there is airway hyperactivity or airway hyperresponsiveness to certain allergens. So this is how we define asthma.
And is childhood asthma different from the asthma that adults experience? Is there any difference?
Childhood asthma is same as adult asthma, but the children, because of the anatomy of their yani airways and lungs, structure of their lungs, compliance of the lungs, it's different. So we can say that it's yani children have to respond in a different way as the adult do. So it is one of the most leading cause of admissions in emergency departments, missing from school, limitations of daily activities, hospital admissions. So childhood asthma is one of the leading cause of emergencies in pediatric emergencies.
It can be quite traumatizing for the child also to go through breathlessness.
Yeah.
And so what are the symptoms? Of course, we know wheezing or breathlessness is one of them. Are there any other symptoms to look out for?
Yeah, the most important symptom is dry cough. Dry cough, it can be intermittent or it can be yani persistent dry cough. So because of this dry cough, the patient can have disturbed sleep or limitations of his or her daily activities. The second one is shortness of breath, and the third one is wheezing in the children. Wheeze, it can be expiratory wheeze. So while during these patient is having symptoms of dry cough, shortness of breath and wheezing, daytime activities, daily limitation of activities is one of the most frequent symptom you can say which is encountered in the children. And because of these this cough, sleep, shortness of breath, wheezing, the child can have this missing any days from the school. It can affect her patient's sleep, and because of these it can affect the overall growth of the child also.
Okay, so asthma is not just shortness of breath, it's also dry cough and wheezing as
dry
well.
cough is most important symptom you can say. It can
so
be
that's the first symptom to look out
dry cough, and the limitation of daytime activities is most frequently encountered in the children.
Okay, so when is the right time to visit a doctor? When does a parent know that this is going out of hands and the child needs medical assistance?
The child, as I have discussed already, if the patient is having dry cough and there is nocturnal exacerbation of dry cough, or there is any early morning dry cough, or patient is having shortness of breath, wheezing, expiratory wheeze, or there are other symptoms like patient is having signs of respiratory distress. There are intercostal recessions, suprasternal recessions, there is flaring of ala nasi, all these symptoms with the patient, you have to immediately visit the doctor. And the patient is cyanosed, he cannot even complete a sentence while he is breathing. So this is very important signs and symptoms to visit a doctor.
So doctor, what are the common causes and triggers that we see? You mentioned it could be because of pollution in the air, or could it be because of any kind of food allergy? In your observation, what are the general causes and triggers for childhood asthma?
Yeah, the most common causes are viral infections, RSV and rhinoviruses. The second important cause is it is also hereditary. If the mother and the father of the child is having history of asthma, then there are chances that the child can develop this childhood asthma. There are certain allergens, it can be indoor or outdoor, aeroallergens we can say. The indoor aeroallergens are dust, mites, cockroaches, and outdoor aeroallergens are spores, pollens. All these, they can trigger asthma. Passive smoking and certain scented perfumes, from the scent of the perfumes, hair dyes. So these are the allergens. When the patient is exposed to these allergens, he is having symptoms of the asthma. He is developing symptoms of asthma.
So it could vary from child to child.
Yeah,
it may not be the same cause for every child. And this is hereditary, right? So to a certain extent, it can be passed on from either the father or the mother.
Yeah, if the patient is having history, and is having history of asthma in father, mother, or first degree relatives, then there are chances are more. Yeah.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
And doctor, can you also throw some light on the diagnosis of asthma? How do you come to the conclusion that this is asthma, and how do you diagnose it? Any specific tests to be done for this?
Yeah, for diagnosis of asthma, you have to take a focused history. You have to ask the patient what are the frequency of symptoms, how frequently the patient is having the daytime symptoms, how frequently he is having nighttime symptoms, or how frequently is affecting the child's daily physical activities, how frequently he is using the short-acting beta agonist. So according to these symptoms, you can categorize asthma into mild, moderate and persistent, mild, moderate and severe category. And secondly, you can do, if the child is greater than 6 years of age, you can do spirometry. It's measure how child forcefully can expirate. It's a device so that we can measure
balls
it. It's a device. So we can measure forced expiratory volume in 1 minute with the help of spirometry. We can do bronchoprovocation test, exhale nitric oxide test. They are a little bit advanced tests. We can do chest X-ray. Chest X-ray can show hyperinflation of the chest wall. And we can do CBC. It can show raised eosinophilic count. So these are the tests we can use to diagnose the asthma. And most important is history. You have to take a focused history and categorize asthma mild, moderate and severe. Yeah. So if he is falling in mild category, he can be having symptoms less than 2 days per week. In moderate, patient can be having symptoms throughout daily. He can have daytime symptoms, and in the severe category, throughout the day he can be having the symptoms. So we can categorize according to night symptoms, the use of short-acting beta agonist, but daytime symptoms we categorize according to mild, moderate and severe category of this.
So there are 3 categories, mild, moderate and severe, and it's very important to know the history, the frequency of the wheezing and the shortness of breath, and how much it affects the daily activities of the child.
Yes,
right?
to categorize asthma. So categorization, we have, according to category, we have to manage the patient. Okay. We have to use inhaled steroids or long-acting beta agonist. So to categorization is important for the management of the this asthma.
So can you talk a little bit about management of asthma? What are the medicines used? I'm sure a lot of our viewers are familiar with inhalers and all that. So if you could just elaborate it a little bit.
So asthma management is necessary to provide the patient a symptom-free period, to focus on the current status of the child, and to provide him a symptom-free period to reduce the further exacerbations of asthma. So divide the treatment into 2 parts. First is early rescue therapy. In rescue therapy, we have to provide immediate relief of the symptoms. You have to give him, we can give inhaled short-acting beta agonist, salbutamol you can say. It can be inhaled, it can be oral. And we can give him a short course of steroids, 5 to 6 days. And then
but steroids, it's not really harmful for the child, right?
No.
There's no need to.
They are beneficial for the child. So to provide quick relief of the symptoms, we have to give short course of, sometimes we have to give short course of steroids. Okay. And long-term management, we use long-acting beta agonist and inhaled corticosteroids. Again, I have already said that we divide into mild, moderate and severe. So for mild, moderate to severe, we increase the dose of inhaled corticosteroids, and plus we add on long-acting beta agonist. Sometimes we combine both inhaled corticosteroids and long-acting beta agonist depending on which category the patient is falling.
So what is an asthma action plan? What should the parents keep in mind, when a child gets asthma? Is there any tips for the viewers on how to deal with it?
Yeah, asthma action plan is basically focused on the daily symptoms, how frequently the child is having the daytime symptoms, and to reduce the frequency of the exacerbations of the asthma. So in asthma action plan, the doctor has to formulate a proper asthma action plan, and same should be given to the caretakers, like parents. Yeah. So in asthma action plan, we use we have to make a certain plan for children greater than 6 years of age. We just divide, we do peak flow meter, we use peak flow meter, and we divide it into 3 zones: green, yellow and red zone. So according to the zone, if he's in a green zone, peak flow metry, it falls in green zone, it means the asthma is well controlled. If it's in yellow, it's moderately controlled, and if it's in red zone, it's poorly controlled asthma. So according to this well controlled, moderately controlled and poorly controlled asthma, we add on the treatment, or we just step down. We call it step up and step down treatment. In step up treatment, if the patient is falling in green zone, we can stop the medicine or decrease the dose of inhaled corticosteroids. But if it's in the red zone, we have to increase the dose of steroids or add on another drug. So this is the way we make asthma action plan.
And would you suggest any lifestyle modifications, since the triggers could be found in the environment outside? Is it okay even if the child goes out, or should the child stay indoors? So what are the lifestyle modifications that a child can do?
In lifestyle modifications, first we have to educate the parents. They have to make a list of allergens. Which allergen child is allergic to, or after exposure to certain allergens, the child is having symptoms of this asthma. So these allergens can be environmental, it can be dust, it can be spores, pollens inside the house, it can be carpets or pets, dander.
So I think the parents have to observe the child, and then maybe make a journal and then find out what exactly is the trigger.
Yeah, it can be any child. If child is allergic to scented perfumes, hairsprays,
and so even they can passive smoking also.
Yeah, passive smoking. So they have to eliminate these from the environment, or avoid these to avoid the triggers of the asthma.
And is this childhood asthma, I mean, can a child outgrow this asthma, or does this last lifelong? Once a child is prone to it, does it mean that throughout his or her life he'll be having asthma?
It depends upon the category. If the child is in the mild category, he can outgrow. But in moderate, 50% of the children, they can develop asthma in adulthood. And in severe asthma, the asthma persists in adulthood. And the 50% of patients that can outgrow in moderate category, they can develop asthma in the later age.
So mild cases, there are high chances that they'll outgrow, and moderate, 50%? There are 50% chances. In severe cases, most likely it will be a lifelong thing to. So doctor, before we wrap up, any takeaway message for our viewers on how to manage childhood asthma?
Yes, I would say that if the child is having asthma, the patient should learn how to live with it. They should give maximum to their child. They can consult a doctor and take a proper management plan, so child can lead a daily, can carry his daily activities and lead a healthy life.
So timely medical intervention is extremely important, and I think parents also need to be aware and look out for all the red flags and what the triggers are. So I guess once they know what causes this, then half the problem is solved.
Yeah.
So thank you so much, doctor, for joining us on the show today. Thank you for explaining to us in detail about childhood asthma. Thank you once again. So friends, I hope all of you found this episode very informative and very useful. For more informative episodes like this, don't forget to tune in to BMC Global Live Al Hilal Health World every Tuesday at 8 p.m. Please make your health a priority. Stay strong, stay healthy and stay happy. Till we meet again next time, this is Anupama signing off. Good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com.